Are you interested in healthcare but you do not want to work with anyone's fluids, or you just don't have the time and patience to deal with patients? If that's you, keep watching this video. Hey everyone, I am your fave Nurse B. Thanks for coming back to my channel. If you are new here, consider subscribing because I have over 200 videos to help motivate, inspire, and educate you in the field of nursing. And as you can see in this video, I talk about things besides nursing as well. I do interviews with different people. I talk about how much I get paid. I talk about schooling. I give you tips with schooling. I give you motivation. I just give you life because I am your fave Nurse B. So consider subscribing and also share my channel. So in this video, I want to talk about careers that do not require any type of patient care. Now, some of these you will be talking to patients and working with them, but you're not going to be dealing with any bodily fluids. I know a lot of people, they don't want to deal with fluids. That's one of the biggest things, but they still want to get some of the benefits from healthcare, such as flexibility in your schedule, working in different environments, abilities to travel throughout the US if you want to move. And also some of these careers, you can travel with these careers, and also some of them you can work from home. I decided to do this list and make it so that there's not a whole bunch of schooling required. But if you want, I can do a video that goes more if you have like your bachelor's degree or associate's degree. I can do more videos that require more education so that there's more pay involved. But I wanted to get some careers that you can kind of get into within about a year and just start working. This is part of a series, so if you haven't, go ahead and go watch the other video that I have up. It's the top careers you can get besides nursing that pay $50K or more a year. Go check it out, because some of those careers I was like, I don't know if I'm gonna be your favorite Nurse B anymore, because some of those careers pay very good money. All right, so number one is medical billing and coding. My mother-in-law is actually a medical billing and coder. I don't know, medical. Anyways, this is what my mother-in-law does. And shout out to you, because she helped me pretty much make this whole list. She was just giving me all the info, all the deets. So I appreciate you. Medical billing coders, on average, they make around $41,000 a year, and the range is between $38,000 and $45,000. I will have all of that information for each career up for you all, and I will have the hourly pay up for you all as well. Education, some programs I saw were 2 years, like at the community college, and then I saw another program that was outside of the community college that was 44 weeks, so that's what, a year, a little bit less than a year. Training here is one school that's 44 weeks is $2,600 to become a medical billing coder. What you all have to realize is that with a lot of these careers, you do have to take some type of certification. So just keep that in mind after you get done with school. So medical billing coders, what they do is they go over the patient's medical records, and they see what they can code to charge the patient. So a good medical biller and coder is going to be able to go through that patient's records and just draw out as much as they can. Like they get as much as they can out of it, so that that physician or that facility can make as much money as possible off of any of the services that were done when the patient was seen by the MD. So they have to really understand like ICD-10 codes, which basically is the codes that you attach to certain diagnosis or procedures. So it's diagnosis, I should say. So like for instance, I know we had to know some of them with nursing. So if a patient gets blood work done, I would put like their ICD-10 code is say they were on like Coumadin, and I needed them to get checked for their blood, PT-INR. I would have to put, why are we doing that? And I would have to put that they have a long-term, one of the ICD-10 codes is long-term use of anticoagulants. So that'd be one of their ICD-10 codes. And then the coder would make sure they pull out as much as possible from that patient's records to bill the insurance. So they are really, really important. A doctor in a facility really needs to have good medical billing and coders. I don't know if that's what they're called, how you say their name, but they need really good ones because that's how they get paid. So that's what they do. With this career, you can actually work from home. You do need to have some experience in a facility first, and then you can work at home. My mother-in-law, she actually said she might want to do this, but there is a big initial like fee like to get the software and everything, because you have to have like a really good working computer, and like your software has to be really good, because there's a lot of, you know, sensitive healthcare information that you're going to have on your computer. So you can do it from home, but you do need to have some experience with this. And they can work in hospitals, they can work in clinics, yada yada yada. So our second career is patient access coordinator. So I told you all, some of these careers you will be working with patients, but this is one where you don't have to deal with fluids. What they do is, anytime you went to a clinic or a hospital and you sat down, like before you were able to be seen, you sat down with someone, you gave them your insurance information, or you gave them payment, anything like that, that more than likely was the patient access coordinator. So they deal with it. They take all your intake information, put it in the computer, get everything together, get the insurance, get the payment, and keep you pushing. That's what they do. So it is, you are dealing with patients, and sometimes you have to deal with certain, you know, personalities, but it's not as crazy as doing like direct patient care where you actually have to take care of these people. So that's what they do. You can work in hospitals, you can work in clinics. Alright, so the third career is a patient access scheduler or a scheduler. Basically, all they do all day is schedule. That's all they do. So anytime you call and you're like, hey, I need to schedule an appointment for yada yada yada, these people are the people you talk to. They can work in doctor's offices, they can work in hospitals, they can work in therapy offices. They pretty much can work at a lot of different healthcare facilities, because pretty much anywhere you go, you're going to have to get scheduled to be seen unless it's like a urgent care. So that's what they do. Their pay is on average $37,000 a year, and it ranges from $33,000 to $41,000. So that's what they do. Oh, I'm sorry, I meant to tell you all the education for a patient access coordinator and patient access scheduler. There's no education requirements. You just have to have your GED or high school diploma. But just keep in mind that for these careers, more than likely they're going to want you to have some type of like clerical experience. So if you've ever like done any type of like secretary work or any type of like office work, that will really help you to be able to get these positions. Hey you all, so although there is not any type of education required for patient access coordinators and schedulers, I did want to emphasize that I saw that there's a certification that you can get called the CHAA certification that a lot of employers were asking for when I looked online at the different job postings. So that's something that you can get to make yourself seem more attractive to potential employers. Our fourth career is verification specialist. So what they do is they actually communicate with the insurance companies to make sure that they can get like prior authorizations from insurance or from doctors. That they talk on the phone all day to the insurance companies. And it's like, say the insurance is like, we're not going to pay for this, and then they have to go back and figure out, okay, why are they not going to pay for it? Why do we need this? They go back and forth, because you know insurance never wants to pay for anything. So these people are there to basically talk to the insurance, see why it's not getting paid for, see what they have to do. Do we have to get prior authorizations from the MD? Do we have to get more information from the patient? Yada, yada, yada. They are there to help the patients to get their services paid for through the insurance, and also for the hospital to not have to take on that cost. And with this one, you do not have to have education, but of course, they more than likely want you to have some type of experience in healthcare or some type of experience talking and communicating over the phone. Alright, so number 5 is a medical secretary. I will tell you that it's so important to have a good medical secretary, like very, very important. So they are the ones who go from, they talk to you as a patient, or they talk to the people, like the nurses. Like, so for instance, I'm a nurse at a nursing home. I call and I want to talk to the doctor about some labs I got in. More than likely, I'm going to talk to his medical secretary. He or she is going to take down the information that I have about the patient's labs and then take it to the MD. If you have a really good medical secretary, then they're going to be like, oh wait, Dr. such and such is going to want this info. Did you get this before I give it to the doctor? And then the nurse will make sure they take care of everything, so that basically they're like there to really organize what's going on between the nurse or the patient and the MD. They make sure that the nurse or the patient has all the information that they need in order to give the information to the MD. And then like they're kind of like the middle person between the doctor and whoever needs to talk to the doctor. So they are very important. They have to be very organized, and they have to have very good communication skills, because sometimes, you know, if patients are calling doctors, that can be a whole thing. If the nurse is calling the doctor, that could be a whole thing. Yeah. So like I said, good communication skills is very important, because you're talking to other healthcare professionals, and you have to be organized, because sometimes, you know, doctors have hundreds, some have thousands of patients. I know, crazy, right? So they have to really be organized, and being able to be that middle person between the doctor and whoever else needs to talk to the MD. So the pay for them on average is $40,000. It ranges between $36,000 and $45,000 a year. And with this one, you do need like some basis of medical terminology. There is no educational requirements with this one either. Also, I saw there was a difference in medical secretary pay, like a huge difference that I would just, that's why I put two different amounts on here for you all. I think it's closer to the lower amount just from all the different job postings I was looking at, but of course everything varies based on your area. If you have a more accurate or exact amount, please put it in the comment section, and also put the location that you're in. Okay, so the sixth, are we on six? The sixth career is medical records. So they have no type of interaction with the patients at all. They on average make $32,000, and their pay ranges between $29,000 and $35,000 a year. So medical records is exactly what it sounds like. They take all the medical records from the patient's chart and they just file it. It's crazy. Like, they just, paper is their whole life. A lot of medical records people right now, what they're doing is they're taking information that was like the paper records and then scanning them into the computer and putting them in the computer system wherever it needs to go. So back in the day, or some people still have paper charting, you would have the whole patient chart, and you would have, like, you know, admission records and immunization records and doctor's notes and nurses notes. You would have all of that in the chart. Nowadays, a lot of people are having to go to computer charting. I'm talking more so in the nursing home, the colleges. The hospitals already have computer charting, but the nursing homes don't all have them. So what they're doing now is they're just going and getting all this information and scanning it into the computer and just make sure it's in the right spot. And that's what they do. So if you call and you need to get like shot records from your kids, more than likely the medical records person is going to get that, copy it, send it to you. They might have to have you sign some paperwork, and then, you know, to release the information, and then send it to you. That's what they do. I would say do this if you don't mind kind of working like in a secluded space, because you're basically just doing paperwork all day. There might be someone in there with you that's working with you, but you're kind of like to yourself doing this. So I would say this is really good for someone who is like an introvert, or just to themselves, and they like to be in their own zone and keep it pushing, but they want that security of, you know, a healthcare career. So the education for this would be a Health Information Technology Associate's degree, or HIT Associate's degree. I'm looking on my community college website, and it is a 2-year degree because it is an associate's degree, and that's what you would have to do to do this career. Not to be mistaken with a surgical tech. This one is sterile processing tech, and I did find a YouTube channel on about this. So her channel is Sterilize My Life, and she has a few videos talking about it, so go check out her channel. But anywho, the average pay is $34,000, and it ranges between $30,000 and $39,000. As far as the education program I found here in St. Louis is 9 months, and it's around $2,100 to do this. I would say definitely look at like workforce programs in your area, or like what do they call them? Yeah, like workforce areas, or look at your community college and see if they offer them in your area. I would not spend a lot of money doing this, like as far as education, because some for-profit schools will have you pay like $20,000 and you coming out making like $13. So just keep that in mind. I got a whole video about it, but anywho, what they do is basically they sterilize any type of surgical equipment And that's what they do. They sterilize it, they organize it, they keep it pushing. They're not dealing with patients at all, which is different between a surgical tech because they actually deal with the patients. But this one, they just sterilize the equipment, organize the equipment for the next surgery or whatever the case may be, and keep it pushing. That's it. That's all they do. So if that's what you're interested in doing, try that as well. And then the last career is a pharmacy tech. Now they do some, like anytime you go to CVS or Dwayne Reed, I used to live on the East Coast, I remember Dwayne Reed, or like Walgreens, more than likely you dealt with a pharmacy tech. They're the ones who basically collect the prescription and give it to the person who needs it, and they keep it pushing. That's what they're doing all day long. They also can work in the hospitals as well as organizing all of the, or clinics, organizing everything that needs to be collected and giving it to the patient or sending it to certain areas in the hospital. That's what they do. So the average pay is $34,000 and it ranges between $31,000 and $38,000 a year. And as far as the schooling, here in St. Louis, I found a place that they offer a 44 weeks, so around the same amount. Yeah, it's the same time as medical billing and coding. And that's a little under a year, and it's $26,000 is the school. I'm not sorry, $2,600 is how much the school costs to be a pharmacy tech. I do have an honorable mention that I wanted to go over, and this one is a nursing home admissions coordinator. So basically what they do is they handle the entire admission versus not the clinical part. Like the nurse would do the clinical part as far as like talking to the doctor, verifying orders, talking to the patient, and writing out different care plans and all that good deal. Like that's what the nurse does. But the admissions coordinator in a nursing home is they communicate with the hospital to see, okay, can we take this person in? Let's check and see what their insurance is like. Let's check and see if they can qualify for Medicare or Medicaid. And then we'll go about getting them into our facility. That's what they do, is they get people in the facility. They bring the money into the facility. So with this career, I saw there was not any schooling needed, but I'm sure if you had your associate's or bachelor's degree in some type of like health information or health, some type of, what you can get like an ally, what is it called? I'm gonna put it up here, but some type of associates or bachelor's I'm sure would give you like a competitive edge. But you do not need a lot of schooling for this. And the pay that I saw was on average $48,000, and then the range was between $40,000 and $59,000 a year. I would say with them, it seems pretty chill to be an admission coordinator from what I saw. Only thing is, like, I know where I was working, like, we hated admissions because it's like they tell you last minute, and the people they bring into these facilities, they just bring anybody up in there. And sometimes they don't even have, they don't know the clinical side of it. So sometimes like they accept some patients who you're like, you shouldn't have accepted this patient, and the patient literally gets sent right back to the hospital. It can be kind of like, it can be annoying sometimes dealing with admissions people, but hey, they get people in the facility. That's how you make money. You have to get new patients, so it is what it is. So that is a list of careers along with a brief introduction and also the pay. Let me know, do you like these type of videos, me talking about other careers you can get into? Put in the comment section, did any of these careers sound interesting to you? I know a lot of people don't want to deal with patients, so I dug and found some careers for you all. So hopefully you found it helpful. If you did, consider subscribing, punch that like button. Follow me on Instagram at YourFavNurseB #1, and also you can join the FavNurseB Facebook group. And what else can you do? What else can you do? That's it. Thank you all so much for watching. I love you. I appreciate you all a lot. I'm sorry, like my throat, everything is just, I'm getting it together. All right, you all. Peace. So something else I want to add is that everything depends on the area that you're in, and also your actual setting of work that you're in as well. I am just a resource. I am in no way means like the one source that you should go to. You definitely need to look in your area. Go on like Indeed.com and see what are the requirements for these specific jobs in your area. Then go on Facebook, join Facebook groups for these specific jobs and see. Ask people in your area when you go to the clinic or when you go to the hospital. Ask people that's there. Open your mouth, ask questions, do your own research, okay? I'm just one of the little people in your world, okay? I don't know everything. So if you do have any other suggestions or want to add to the list or want to clarify anything, put it in the comment section for me. Thanks again for watching. All right, you all.